Welcome to Leaders and Legends, a show about the very best doctors in regenerative, orthopedics, and sports medicine. I'm your host, Dr. Charles Mahl. My goal is to give you an in-depth look into the lives of the top experts in regenerative medicine, the doctors' doctors, who are globally recognized for their skill, compassionate care, and commitment to finding cures. These are the physicians who teach internationally and nationally, the ones I would trust with my own care, and the absolute best of the best. How did they get so good? What makes them tick? In each episode, I sit down one-on-one with these remarkable individuals to hear their unique stories. Whether you're looking for a few life lessons or you're a fellow physician hoping to pick up a clinical pearl or two, this show is for you. So sit back, relax, listen, watch, and enjoy. Thank you. I'm Dr. Mahl. I am happy and delighted to have with me today as my guest physician, Dr. Brian Shiple, who's probably in the top 10 of physicians in regenerative medicine in the United States. I'm happy to tell you that I've learned so much from Brian over the years. Even sitting in the same room, listening to talk to other doctors, I learned from him. And we have a good friendship going. Brian, I'm happy to have you here in a nutshell. Where did you grow up?
My dad was an oil man and worked for an oil company that moved him every 2 years. So I spent my first 10 years in Michigan. I was born in Ohio, and then we moved to Florida. We didn't move very much in Florida, so I consider growing up in Southeast Florida. I went to high school in Fort Lauderdale, and then I left to go to college, and now I'm back in Florida. I'm kind of saying
You just did this recently.
Yes,
in
yeah,
Florida.
yeah.
The last 6 months.
Yeah, last 6 months. We moved to Florida, kind of saying I'm going back home.
On the West Coast.
On the West Coast instead of
different scenery there on
Yes,
the West
exactly.
Coast. Well, I wish you well in that new move. You were in the Philadelphia area for 30 years or
Yep,
so.
that's right.
You were running a residency program, director of education up there.
I ran a fellowship program in
program.
sports medicine. And
Wonderful.
was division chief of sports medicine for a $500 million hospital system. I ran the department and ran the fellowship program.
Very interesting.
Yeah.
Very
So
interesting.
kind of cut my teeth in medicine and in the academic world.
You just wanted to come back to warm weather then, right?
Exactly.
That's
exactly.
funny.
Yeah.
Well, folks, I want to tell you a little story about Dr. Shiple. Probably about 15, 16 years ago, I was with one of my mentors. You know this story already.
Yeah.
And we're at a workshop in Connecticut on how to learn ultrasound. And it's at the beginning of the lunch hour. I'm sitting in the room with my mentor, and in walks Dr. Shiple a little bit late because the place is crowded now. And my mentor leans over to me and goes, "See that guy walking in now? He's going to be the smartest guy in the room." And that was my first introduction to you.
Right.
So I knew I wanted to get to know you at that time because that's what you were thought of by Al Stein.
Sure.
And he certainly was right. But you've had a great career. You lecture everywhere for AAOM, missionary trips together we've done in numerous spots. And have you done stuff in Europe too? I know you've been over in Italy and places like that.
I did with Jeff Patterson.
Yeah.
He invited me to help him do a prolo workshop in Verona, Italy.
Very
What a
nice.
trip that was.
And your patients come from all over the world,
They do,
right?
yeah. A lot of them do come from out of state and out of country. So yeah, it's been a good ride. I still love what I do. So my patients from Pennsylvania, now that I'm in Florida, they call and say, "Are you still seeing patients, or have you fully retired?" And my answer is no, I'm semi-retired. I'm working 3 days a week, 3 weeks a month. And it's going well so far.
That's terrific. And they still come down. They want to see you.
Yeah.
I told you that.
Yeah, you
I
did.
told you that
Yeah,
because you have the name, reputation, and the experience, and patient-centric care, I call it. Just compassion and being kind to people, and they know your outcomes. So they want to come down and see you. I think it's wonderful. We know about your career. What's the kind of stuff you like to do when you're home with your wife and family? You got a boat yet?
I
You're on
do.
the West Coast?
I do have a pontoon boat on the west coast of Florida, which has been great. We call it the party barge.
You go out there on weekends to
Yeah,
relax
yeah,
and de-stress.
Yeah, go to restaurants and
wonderful.
go for cruises. Yeah,
Good.
it's a lot of fun.
And you had a little home in Philadelphia
Yes,
you went to?
Yeah, we have a vacation home in New Jersey, in Avalon, New Jersey. So we go there. That's our Shangri-La. That place is very unique. Pull in, I'll turn the car off, leave the doors open, go in the house, leave the doors open. It feels like we're back in the late 50s, early 60s.
I think it's great.
Yeah.
I want to switch gears back to your professional career. When do you stop at night? Because I know you're working all day long with patients, not just easy things in our field, but very hard, complex issues. And then I know you go home and you're reading journals and calling people and figuring out where you're needed to lecture. And you rarely say the word no. I don't know that about you ever doing that, frankly. I say it over and over again. You're a doctor's doctor, and that's a wonderful thing. We have this feel to us that we want to help people, and that's the highest honor that we can do, is change lives with giving people good care.
We expect our patients to get better by having an accurate diagnosis and creating the right treatment plan and then carrying that treatment plan out. And when they don't, that's what keeps me up at night. And I think it keeps us all up at night is what can we do better? How can we learn to treat more patients and get them better? And that's what drives us, especially the ones that are doing the lectures and whatnot, that keeps us stimulated.
I know you have a number of different companies, stem cell companies and platelet-rich plasma companies. Maybe you want to talk about that a little bit.
So early on in the PRP world, I tried every kit that came out, and we had good results. But again, in the patients who didn't successfully get what we were looking for, I wondered, can we make the kit better? Can we make PRP better? So I started experimenting. Gosh, that was probably 20 years ago. And I started making PRP in syringes, and we had a centrifuge lab, and I created inserts in the centrifuge that would fit our syringes. And you had to spin them very fast, and the syringes would break.
First,
the caps on them they would fail, and the blood would come out of the syringe, and at 4,000 RPMs, the machines got very unbalanced and they would fly off the shelves. There'd be blood all over the walls or whatnot. And my staff dreaded, we called it Research Fridays.
Oh my God.
And so they're like, oh God, Dr. Shiple, what are we going to do this Research Friday? All right, everyone, give us your arms. We're going to pull blood and we're going to experiment on PRP. So I came up with a method of making PRP called the two-spin method. And I gave it to two companies that were friends of mine. Not a very good businessman, but I gave it.
Great doctor.
The double spin PRP method was something I came up with and proved that we could make stronger PRP with less blood. And I gave it to a couple of different companies who have become big companies because of it. My method, I have that in my own kit company that we're trying to get through the FDA right now. Everything in the kit is FDA approved, but when you sell a kit to the market, the kit itself has to have an approval for an indication to make
Even though
PRP.
the supplies are all FDA approved.
So it's called a blood separation kit right now, but once we get our FDA approval, we can then name it a PRP.
Well, I wish you a lot of luck.
Yeah, thanks. But we've been using it for about 4 or 5 years, and it's a great kit, and it's going to be competitive with the market. But right now, we're selling it at a much reduced cost compared to the rest of the market. So
now, if I can ask you, what's the most fun you have in the office as far as a procedure,
Sure.
technique?
It's got to be spine.
Spine work.
Yes.
You enjoy that.
Yeah, I do. The results we get with our spine work with a procedure technique we call spine renew, where we treat the whole spine, the whole area of the spine, meaning
the whole lumbar spine,
the set joints, the ligaments, the tendons, the muscles, the fascia, the discs. We treat nerves and whatnot. It's a very comprehensive treatment, and it has a high success rate in getting patients better that are facing surgery or who even failed surgery. So getting those results where patients have had 10, 15, 20 years of chronic pain and they're disabled or they're considering spinal fusion and we're able to save them from that really dangerous surgery, it's really rewarding to be able to get those patients better.
You bring up a good point in that the spine work that we do, the lumbar spine is the most devastating injuries that we see or life-changing for people. And if we can get them back to the living and enjoying themselves, it is an amazing difference in their life. They can handle a joint that's out of whack or something like that, but the lumbar spine, when it goes, they're constantly going for desperate treatments that don't necessarily do anything. You've always been on the forefront of finding these type of potential cures for people. So I wish you a lot of luck with that, and I'll probably try it myself.
I actually just came back. I got invited by Congress to present my Spine Renew program to Congress to get accepted into the VA program, so the vets can have access to this and get it paid for. So we've been successfully treating vets now for less than a year in the practice in Florida, the results we're getting in these vets is remarkable. It's
terrific.
And
with the spine renew procedure.
With the spine renew procedure, and the patients one of the patients specifically, he used to be a special forces operator, and now he works for the Pentagon. And he's a young guy. He's probably in his late 40s, and he is the liaison between Capitol Hill and the Pentagon. So if a congressman or a senator has questions about what we're doing in the War Department over in this country or that country, the senator calls the Pentagon, and this patient of ours gets on the phone with them and explains the situation. Well, so he knows all the congressmen and senators, and he's had our treatment.
Wow.
He's fixed. And
Terrific.
he's screaming from the mountaintops to get this approved. So that's kind of where this came from. And then they one by one, the people who are making the decisions at the VA level, the secretaries of the VA, the undersecretary of the VA, we had dinner with surgeon generals, we had dinner with and whatnot. And we explained the program. So they wanted to get approved, but we have to do a study first.
Yeah. We should mention that these treatments are non-surgical treatments. We're trying to prevent or delay surgery in people. Because surgery, if it works, is great. If it doesn't, it is devastating.
Yeah. Especially in this area.
Yeah, you're signing up for more and more procedures because you're still in pain and hurting.
Right.
So it goes back to the whole concept of why we do what we do in regenerative medicine, which is treating not just the nerves, but the ligaments, the tendons, the muscles, and everything related to the spine. The muscles atrophy, we know that. So if we can make you stronger, we're going to help people. So.
Yeah.
I think what you do is great. I'm honored to interview you right now and talk to you about this stuff. And I appreciate you coming on the show. I look forward to your successes in the future. And you got to promise me you'll come back.
Absolutely.
All right. I love you.
All right.
Shiple, my pleasure.
Love you too.
It might
Thank
seem
you.
crazy what I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Yeah. Well, give me all you got and don't hold it back. Yeah. Well, I should probably warn you, I'll be just fine. Yeah. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if